My name is Dr. Sanjay Govil. I am a consultant HPB surgeon and liver transplant surgeon at Apollo Hospitals in Bangalore. Uh, Liver transplantation is the standard of care for patients with irreversible liver disease, most commonly decompensated chronic liver disease. Um, and while it is now a standard of care and has a perioperative risk, which is only in most patients is only within the region of approximately 5%, 5 to 7%. Uh, it is associated with certain complications. And what I'd like to do today is to explain some of the more important complications to you. Now, these complications are time bound during the operation. So, first of all, we'll just briefly consider during the operation, the most important complication is bleeding. We have to remove the patient's cirrhotic liver. The cirrhotic patient does not have normal blood clotting, and they have a condition called portal hypertension, in which the blood vessels in their abdomen around their liver are very dilated and very overloaded with blood. There is always some amount of bleeding while removing the liver, and it's not uncommon for us to have to give transfusions to replace this blood loss. However, it's usually very easily manageable, and it's rare for there to be major blood loss in liver transplantation today. Following the operation, within the first couple of days, we are faced with two potential complications. One is vascular technical complications, and the other is whether the graft, the new liver, how well it functions. So all the blood vessels that we've joined together during the operation, although we confirm that there is good blood flow through them at the time of the operation with a Doppler ultrasound performed during the surgery, there is a possibility that some of these blood vessels can get blocked in the post-operative period. Blood clots may form within them. In adults, the vessel which gets blocked is usually it may be the hepatic artery. A hepatic artery thrombosis can occur in approximately 1% of patients, and this is a serious complication that requires reoperation most often to fix. And in some patients, if it cannot be fixed, then these patients may need to have a retransplant. However, remember, it occurs in approximately 1%. In children, you can also get a blockage of the portal vein, but that is usually correctable, although it requires most often reoperative surgery, reoperation. It's usually correctable. The other, as I mentioned, is poor graft function or sometimes non-function of the graft. If there's non-function, it's serious, because once again, most often you would require to have a retransplant to fix this. However, if you get past the first few days while these major important risk and life-threatening risk factors occur, then and as I mentioned, both of these occur in approximately 1 to 2% each. The next point of risk is towards the second week of the surgery, and at this point you're looking at two complications: either rejection of the organ or infection. Rejection is something patients worry about a lot, but fortunately in the liver it's not such a major problem, and it's usually easily managed with medication, and we just have to adjust the dose of the medication to fix it. Rarely it requires a biopsy. When I say rarely, I mean in about 5 to 8% of patients it might require a biopsy before one gives a very high dose of steroid to correct the problem. Infection can be more of a problem. These are normal post-operative infections in most instances, which arise from within the patient's own body. But because these patients have had repeated hospital admissions prior to surgery, They often have hospital-acquired bacteria within their body which are resistant to normal antibiotics. And also, because in order to prevent rejection, all these patients are on immunosuppression, and therefore their own body cannot fight against these infections as well. So while they are normal post-operative infections, getting over them is a little bit more difficult than for the average patient who gets a post-operative infection after normal surgery. However, once again, most patients will completely recover from these infections, and it's only a minority who may have an infection which is very serious. Finally, there is one of the joins that we have to make when we're doing a liver transplant is to join the bile ducts. And the bile ducts can either can get scarred, and this cause a narrowing of the bile duct over a period of time, in which case the patient gets recurrent jaundice. Such patients would require treatment with endoscopy and a stent placement in order to open up the bile duct, but sometimes they require a relatively minor operation in which the bile duct is joined directly to the intestine, which is called a hepaticojejunostomy, in order to correct the situation. So these are the common complications associated with liver transplantation.